Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Erectile dysfunction, your choices. Introduction. Impotence is a common condition. A man who is impotent is persistently unable to achieve or maintain an erection for satisfactory sexual intercourse. Millions of men have erectile dysfunction or ED. Erectile dysfunction is the medical term for impotence. Most men experience erectile dysfunction during their sexual life. Professional help may be needed if erectile dysfunction becomes a persistent problem. This program will explain the causes and treatment options for erectile dysfunction. It also discusses ED oral medications. Anatomy. An erect penis has three main tube-like structures. Two of these are long tubes known as corpora cavernosa, one on each side of the penis. The third tube-like structure is the corpus spongiosum, located between the two corpora cavernosa. It contains the urethra. The urethra is the tube through which urine and semen exit the body. It does not play a role in forming or maintaining an erection. When the penis is flaccid, or not erect, the corpora cavernosa are not filled with blood. Sexual stimulation, both physical and mental, causes the brain, nerves, blood vessels, and hormones to send orders to relax the muscles around the corpora cavernosa. As the muscles around the corpora cavernosa relax, the corpora cavernosa fill up with blood. When the corpora cavernosa trap the blood, they expand. The penis becomes firm and elongated. This results in an erection. After orgasm, the blood empties from the corpora cavernosa through the veins of the penis. The penis becomes soft or flaccid. Testosterone is a sex hormone secreted by the testicles and is important in regulating the frequency and magnitude of an erection. The younger the patient, the easier it is to achieve and keep an erection. Erectile dysfunction is more common among older men. However, erectile dysfunction is not an inevitable consequence of aging. About 1 in 4 men above the age of 65 are affected by erectile dysfunction. Symptoms and their causes. A man who has erectile dysfunction is persistently unable to achieve or maintain an erection for satisfactory sexual intercourse. Erectile dysfunction can be caused by many disorders. It can be caused by medications, psychological factors, or physical factors. Medications are the leading cause of erectile dysfunction. Some medications taken for depression or high blood pressure could cause erectile dysfunction. Some cases of erectile dysfunction are psychological. A man's failure to achieve an erection could have originated from his abuse of alcohol, cigarettes, or recreational drugs. If the man continues to fear not being able to have an erection, he may develop persistent psychological impotence. Stress and other psychological factors can cause erectile dysfunction. When erectile dysfunction is caused by psychological factors, the man has erections while sleeping or early in the morning before going to the bathroom, but cannot achieve an erection when making love. Marital or job stress, alcohol or drug abuse, performance anxiety, financial problems, and other factors can all play a role in starting, maintaining, or worsening erectile dysfunction. Physical impotence is caused by a disease, injury, or operation. Examples of diseases that can cause impotence are diabetes, high blood pressure, cholesterol deposits in the blood vessels, nephritis, liver disease. Examples of injuries that can cause erectile dysfunction are injuries to the penis, pelvis, spinal cord, brain. Examples of surgeries and treatments that can cause erectile dysfunction are operations in the pelvis, surgical removal of the prostate gland, bladder, or rectum due to cancer, radiation therapy to the pelvis. Hormones are substances produced by the body to control body functions. The lack of or excess of hormones could also cause erectile dysfunction. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. Your healthcare provider will evaluate your condition in order to determine the specific cause of erectile dysfunction. He or she will prescribe the best treatment for you. The evaluation usually includes a medical history, a detailed sexual history, a physical examination, and other basic tests. The healthcare provider tries first to determine if the causes are psychological or physical. If no erection can be achieved during sexual activity, special devices can be fixed on the base of the penis at bedtime to monitor whether an erection has happened during sleep. If the test shows that an erection has happened, there is a good chance that the erectile dysfunction could be caused by psychological factors. Treatment options for erectile dysfunction. The treatment of erectile dysfunction depends on the cause or causes. For instance, if the erectile dysfunction is caused by medications you are taking, changing some of the medications or their dosages may help. If erectile dysfunction is caused by severe clinical depression, antidepressant drugs may be the first course of treatment. In very rare cases, erectile dysfunction is caused by a lack of hormones. Hormone replacement therapy could help in these cases. The use of pills or injections usually will restore normal erections in cases of hormone-related impotence. If erectile dysfunction is caused by psychological reasons, counseling or sex therapy may help. There are several other treatment options that your healthcare provider can recommend, such as oral medications. Other treatment options include urethral suppositories, injections in the penis, vacuum devices, and surgery. Many oral medications are cleared by the Food and Drug Administration, FDA, for treating erectile dysfunction. The use of these drugs is explained in the next section. One treatment option involves pushing a urethral suppository into the urethra with a special applicator. The medication dissolves in the urethra and is absorbed into the penis. After about 5 minutes, an erection is achieved. This treatment helps many men achieve an erection. Another treatment option for erectile dysfunction is the use of a vacuum pump and a tension ring. A plastic tube is placed over the penis, and the patient uses the pump to draw blood into the penis by removing air from the cylinder. For most patients, an erection is produced in 1 to 2 minutes. A rubber constriction ring is then placed at the base of the penis to keep the blood in the penis and maintain the erection. The vacuum tube is then removed. The ring should be taken off within 30 minutes or in case of pain, severe discoloration, or cooling of the penis. Leaving the ring in place longer than 30 minutes could cause damage to the penis. Another treatment option for erectile dysfunction is injections of medications by the patient himself directly into the penis. This may help achieve an erection. Through a small needle, a special medication that allows the blood to be trapped in the corpora cavernosa may be injected directly in the penis 5 to 15 minutes before intercourse. This usually gives an erection that can last up to 1 hour. The injection is given with a very thin needle. If you and your healthcare provider choose this option, you will be taught how to administer the injections yourself. If none of the previous treatments are helpful or practical, surgery may be recommended. The most common surgical alternative to help erectile dysfunction is to place an implant inside the penis to help achieve an erection. In rare cases, vascular surgery is recommended if the blood vessels of the penis are causing the erectile dysfunction. There are several types of implants to choose from. These implants differ in the manner they are operated, how natural the erection feels, the number of components implanted, and the possibility of mechanical malfunction. The following is a brief description of some implants. A malleable implant consists of 2 rods that are inserted into the corpora cavernosa of the penis. The rods may either be positioned up for intercourse or down for everyday activities. This is a simple implant and is easy to use. It has few parts and is durable. However, the patient will always have a rigid penis. Another type of implant consists of self-contained inflatable cylinders. To produce an erection, the patient pumps the top of the cylinders to force fluid into the cylinders, making the penis stiffer. To make the penis soft again, the patient simply bends the penis. This is a simple implant and is easy to use. Another type of implant is more complex mechanically. However, it allows the implant to be pumped into a more solid erection. It can then be deflated. Prior to intercourse, the patient inflates the device by squeezing the pump. The pump can be placed in the scrotum. This implant is slightly more complex to place and operate. ED medications. A man achieves an erection when the muscles of the penis relax, allowing blood to flow and pool in the corpora cavernosa of the penis. Medications can relax the smooth muscles of the penis, allowing the corpora cavernosa to fill with blood. Medications vary in how they are taken, when they begin to work, and how long their effect lasts. There are also differences in their side effects. Your healthcare provider will tell you when to take your ED medication and how long its effects can last. Remember that for these medications to work, sexual stimulation is necessary. These medications do not cause an erection if there is no sexual stimulation. The sexual stimulation can be physical or mental. Most patients are satisfied with the improved quality of the erection and with the ability to maintain the erection for satisfactory sexual intercourse. These medications do not increase your sex drive and do not affect orgasm. ED medications are effective for most patients. These medications come in different doses. Your healthcare provider may need to adjust your dose for the medication to work or to decrease the side effects. Some medications work best on an empty stomach. Others can be taken with or without food. Some ED medications take effect right away. This makes it possible to have an erection right after taking the pill. Other medications require 15 to 60 minutes before they take effect. With some medications, erections can happen any time within 4 or 5 hours of taking the pill. This does not mean that the erection will last for 4 or 5 hours. It means that an erection can happen any time during that time period. Other medications work for up to 36 hours. Your healthcare provider will discuss the dose, side effects, and risks of the medication with you. Risks and complications. Some ED medications may be very dangerous when taken with other medications. Your physician will tell you what medications you can and cannot take with ED drugs. ED medications should not be taken with nitrate medications. They may increase the effectiveness of nitrates. Nitrates are medications used to decrease the blood pressure in patients with hypertension, heart disease, and angina. Using these medications with nitrates can lower blood pressure so much that it can lead to death. The patient and his healthcare provider should look for another treatment option for erectile dysfunction in patients taking nitrates. This is one of the major reasons why you should inform all of your healthcare providers about the use of ED medications prior to starting any new drugs. Never share prescription medications with friends. These friends may be taking other medications that are dangerous and even fatal when taken together with ED medications. The dosage of your ED medication may need to be adjusted when taken with other medications. Make sure to tell all of your healthcare providers and pharmacists about all the medications you use. If you have had a heart attack, stroke, or serious abnormal heartbeat in the last 6 months, do not take ED medications. Check with your healthcare provider. Patients with uncontrolled high blood pressure or abnormally low blood pressure should not take these medications. If you have any side effects, you should let your healthcare provider know. He or she may want to adjust your dose. There are also very rare but possible side effects. These include permanent vision loss, sudden hearing loss, and a long-lasting painful erection, also known as priapism. The following pages discuss these rare but serious complications in greater detail. Vision loss. A condition called non-arteritic anterior ischemic optic neuropathy, NAION, has occurred in patients who have taken these medications. It is not known whether the medications caused the problem or whether they just happened to occur together. Because of this potentially devastating rare complication, patients with a retinal disorder, such as diabetic retinopathy, should see an eye doctor before taking any medication for erectile dysfunction. Sudden hearing loss. Hearing loss has been reported after taking ED medications. Like vision loss, healthcare providers are not sure if the medications caused it. If you notice sudden hearing loss, stop taking the medication and check with your healthcare provider. Priapism is a rare condition that can be painful and requires medical treatment to avoid damage to your penis. If you have an erection that lasts more than 4 hours, see a healthcare provider immediately. Medications for erectile dysfunction do not protect against sexually transmitted infections, STIs, such as AIDS. They also do not prevent pregnancy.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A man who has erectile dysfunction is persistently unable to achieve or maintain an erection for satisfactory sexual intercourse. Erectile dysfunction can be caused by many disorders. It can be caused by medications, psychological factors, or physical factors. The treatment of erectile dysfunction depends on the cause or causes. For instance, if the erectile dysfunction is caused by medications you are taking, changing some of the medications or their dosages may help. If erectile dysfunction is caused by psychological reasons, counseling or sex therapy may help. Other treatment options include urethral suppositories, injections in the penis, vacuum devices, and surgery. ED medications are effective for most patients. Some ED medications may be very dangerous when taken with other medications. Your physician will tell you what medications you can and cannot take with ED drugs. There are also very rare but possible side effects associated with ED medications. These include permanent vision loss, sudden hearing loss, and a long-lasting painful erection, also known as priapism. Knowing about your ED treatment options, the benefits, and the risks and complications associated with these options will help you make a more informed choice. Thank you for using Explain.